Okay, it looks like I have the top of the hour. I see more people are joining, but we'll go ahead and just get started with this and go ahead and get us going. So officially, hello everyone. Thank you for joining us for today's webinar. We will be learning about rural health operational and quality best practices. The webinar today is being recorded and will be posted to our website. We will also send the recording and the slides to all the participants at the end of the series. I'm Denise Tackett, Quality Consultation Program Specialist with the National Rural Health Resource Center, which is providing this webinar today. We do ask that you turn on your video if you're able. Your video control icon can be found in the lower left corner of your screen. Your audio is muted by default to avoid background noise and feedback. So please remain muted unless you have a question. To unmute your line, please select the microphone icon also in the lower left corner of your screen. If you did dial in, you can press *6 to unmute your line. And you can also communicate through the chat box, which is located on the bottom ribbon in the middle of your screen. And if you haven't already, please take a moment to type your name, title, and organization in the chat box so we know who is joining us today. This helps us get a good feel of the audience on the webinar.
I hit unmute.
Escape so you can see the volume.
We've got somebody, yeah, we're working on mute. There we go. So the National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities. The center is the TA provider for the Delta Region Community Health Systems Development Program. The Delta Region Community Health System Development Program is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. The center is committed to diversity, equity, inclusion, and anti-racism, and building a culture where differences are valued. To learn more about our commitment, please visit our website at ruralcenter.org. And this is a list of some upcoming webinars, including next week's Quality Improvement Series, Just Culture. And this quality series does qualify for ACHE continuing education credits. If you would like to receive credit, Caleb Lazinski will be sending out an email upon the completion of the webinar series in which you may fill out to receive your CE credit. And before I introduce our speakers, Caleb will be pulling up the poll. There it goes, I see it. These polling questions are rated on a confidence scale and help us measure knowledge gained on today's webinar. So it's just a very quick, brief poll, 3 questions as you see on your screen, and you use the confidence rating scale of confident, somewhat confident, neutral, somewhat unconfident to unconfident. And then as we see those results, then we can move forward. I'll give you all just a few minutes to, just a few moments to get that. Okay, do we have any results up? I don't know. Okay, there we go. There's our results. Okay, so we do have a good amount of you who are at least somewhat confident, but there is some room and some opportunity for knowledge gained here. So we hope this is beneficial to you. And we'll go ahead and close that. And I'm going to move forward now. I'd like to introduce today's speakers. Carla Wilbur is an accomplished nurse administrator with a strong background in clinical care, education, lean process improvement, and emergency services. She joined Stroudwater in 2014. Carla focuses on supporting rural providers in quality and operational improvement initiatives. She has completed numerous facility assessments and process improvements in quality, care management, emergency department, and care transitions for critical access hospitals, rural and urban health systems, and provider groups. Currently, Carla leads process improvement efforts in the development of the clinical care delivery spectrum and workflow optimization. She's passionate advocate for combating the opioid epidemic and a leader of the Stroudwater opioid management team. Cameron Smith is a former hospital leader who believes that behind every statistic is a person who is trusting us with their care. With a background in engineering and mathematics, he uses data analytics and process improvement methodologies to strengthen the health of our communities through partnering with local health systems. His work focuses on helping health systems find the root cause of their strategic and operational challenges and transforms those challenges into opportunities. At Stroudwater, Cameron serves clients as part of the clinical and population health strategy teams. Welcome to you both, and thank you for being here today. With that, I will turn the presentation over to you.
Thank you, Denise. And thank you guys for attending. We're really happy to be here with you today. You know, Cameron and I have the great opportunity to work with hospitals across the country and see what works, and we'll love to share best practices with the hospitals that we work with so that, you know, everyone can share in improving that patient experience of our organizations. Next slide, please. So today we're going to talk with you about understanding the importance of organizational quality and how it shapes the patient experience, learn some techniques to engage patients in their care, which is hugely important, and make the care continuum easier for them and the organization. And then understand how overall financial and operational strategies can impact the patient experience. Next slide.
So what you guys are looking at here is what we consider the transition framework from a fee-for-service type of methodology to a population-based payment system. And on the left hand of this V-looking diagram, you'll see that there's really three key sections: the delivery system transformation, a population health system creation, and then also updating our payment system to transform. And as you move from left to right, from this fee-for-service through the various phases to a population-based framework, there are key sections that you need to be implementing, planning for, and strategizing for. And those are within those brackets under fee-for-service. And what we're really going to focus on today is improving that quality and efficiency, but also looking at the population's health system creation of data analytics and care management and following evidence-based protocols as we move forward into this population-based health system plan. And what we really consider key fundamentals of success for rural health are really understanding the difference between variable costs, fixed costs, fully allocated costs, and making sure that we're really spreading our economic imperative over thousands of mini contributions to cover the fixed costs of critical access hospitals. And what we're really looking for is three key things. We're looking at getting paid better for what we do, growing volumes, and reducing expenses. And what we're really focusing on today in this presentation is growing volumes and growing that overall population. And to do so, we have to have a positive patient experience and a strong quality infrastructure to make sure patients are choosing our organization. And really the value equation that defines what we're looking at here is patient value equals quality over cost times the patient population. The overarching goal of today's presentation is to really focus on how do we drive this population into our organization and expand quality of services and grow the patient experience.
So first we want to go through the quality infrastructure. So quality program best practices, we'll look at the QIPI committee and what that looks like for organizations and what works well, about dashboards and why we need dashboards to share our data and to make sure that everyone understands what our focus is, performance accountability, and then a bit around staff engagement. Next slide. So your quality infrastructure, we always recommend that we have an established QIPI committee, and that committee meets monthly, and it includes an interdisciplinary team. We find that in the rural hospital environment, very rarely do we have board members and frontline staff members attending these meetings. And that's really important for a variety of reasons. We want our board members to be members of our quality committee, even if it's a rotating board member process, so that they can take back then to their other members of the board what really goes on in the quality committee meeting, so that they have a great understanding. Along with your physician champion, we expect our physicians to be part of quality in our organization, so we need to have physician champions on our quality committees as well. Frontline staff members are really important because we ask our frontline staff members to do so many things to help us to collect data, to report data, but we need them to understand what we're doing with the data as well. That gives them more engagement in the process of quality in our organization. Another method of driving focus and direction for our teams is dashboards and scorecards. We need to make sure that our organization has dashboards, scorecards, performance benchmarks, and that these are shared. These are shared throughout the organization, not just with our clinical folks, but with everyone within the organization, so they can understand what quality metrics are we focusing on, where are we, and where are we going. And regardless of whether those scores are good or bad, what are we doing about it? What are we trying to do to drive that performance? So sharing those dashboards and scorecards everywhere in the organization, and all of our departments and our department break rooms and our department bulletin boards, so everyone can speak to the fact that our organization really is invested in quality improvement and what all of the departments are doing. We also recommend that we share our quality metrics with the public. It doesn't matter that we are not where we want to be. It demonstrates that we do have this investment in quality in our organization, and it can show what we're doing to drive that, that improvement effort. Maybe showing certain types of projects that we have going, to support that quality effort to improve that particular metric. So all of that needs to be visualized so that we can make sure that everyone in our organization understands the focus of our quality programs. Next slide. In addition to that, we want to make sure that we have forums, at least on a quarterly schedule, so that we can share information throughout our organization. It's really important that every staff member understand what's going on in the organization. So whether that, and we cannot over communicate. So whether that means through newsletters, emails, different methods of communication, whether we post communication, we still need to have forums where we can have a group at different times of the day come in and hear what we're doing, what's going on in our organization, and answer questions for them. I'm sorry to stop, but I see that there are, it says slides are not advancing. Are we having any other difficulty with that for anyone else?
I see the quality infrastructure slide. Is that the one we should see?
That says internal communication?
Yes.
Okay, yeah. Evidently, Washington County is not seeing them advance, so I'm sorry. Okay. All right, thank you. We'll move forward. Along with having forums, one thing that I would point out that works well is if you are going to establish quarterly forums with your staff members, is to first ask staff, what do you want to hear about? Do you want to hear about the hospital's recruitment and retention efforts? Do you want to hear about our financials? What do staff members want to hear in these forums to make them much more productive? And then make sure that we have minutes with the forums so that we can share them with people who were not able to attend. We should have daily interdisciplinary huddles, whether that is through conference call or whether that is a huddle where everyone comes together within the organization. We call those stand-up meetings because they're not meant to be long. It just brings everyone together so that we're sharing what happened yesterday, what's going on today, and are there any different safety issues that we need to discuss or that everyone needs to know about within our organization. Next slide.
So as we look at quality assurance and performance improvement across the entire board and tie that back to patient experience, looking at educating all of our staff, providers, and the board on the quality initiatives of the hospital is really essential because those staff members, providers, and board members are also members of the community that you serve. And having them being able to eloquently speak and articulate what's going on within the hospital's four walls is important so that community members also understand that there are initiatives being taken to improve quality and safety efforts throughout the care continuum. It's also a great opportunity for everybody to gain insight on what the community is actually saying about the hospital and the experience there. So as you work with your board and your staff and your providers and then set up that quality infrastructure and engage everybody on quality initiatives, make sure you're gathering feedback from a variety of sources as well, because that engages everybody on the opportunity to look at potential process improvement projects and new things to drive overall engagement improvement throughout the care continuum. As we look at that quality assurance and performance improvement program, make sure that the board chairperson is approving this and the hospital administrator and the chief of staff are all reviewing this annually and in agreement with the direction that we're taking the quality plan and the overall quality program of the organization. Patient experience should be included inside that quality assurance plan as a key function of what we're looking at as a strategic imperative. If patients aren't happy with what we're providing and what we're doing within our four walls, we've got to make sure that we're addressing that and making sure that we're going to be around long-term for our community. And then making sure that we're utilizing a standardized quality improvement methodology such as Lean or Plan, Do, Study, Act to hardwire results throughout the organization. Quick little PDSAs on rapid improvement events on key processes where we know there's opportunity to improve, especially in areas such as the ED, are crucial to learning and growing as an organization. Making sure that we document it clearly. If you are familiar with A3 processes, utilizing an A3 to document and track projects is also something that can be utilized.
Staffing is, oh boy, a big subject these days. Everywhere we go, we hear about staffing, recruitment, retention, issues and concerns. We want to make sure that we have developed a standardized orientation program for all of our new employees. That really is important as we move forward to make sure that the standardized orientation program starts that employees' tenure with our organization out very well. We set them up for a great experience with our organization where they have an orientation that's very supportive, so that we can retain our employees. We need to make sure that we're conducting annual employee surveys and using those survey results to improve our employee satisfaction and their engagement. Any of the concerns that we hear from these employee surveys should be addressed and shared back with our employees. This definitely can help you identify areas of improvement in the work environment. And it's important that they see that we really care about what their concerns are and that we are addressing those and bring them into the fold into helping us with a solution approach for the results of our employee surveys as well. It also helps us with identifying any training needs and whether or not we need to develop new training for our leadership. A structured, really intentional leader to employee rounding can definitely help and strengthen those relationships and be hugely impactful in our staffing retention and staff satisfaction. It helps us to really where the staff see the leaders on the floor and they're rounding on staff. It shows that we are approachable, that we do want to hear from them, and that we appreciate them, and that we do address their needs by asking what their concerns are and how they're, how's it going? We like to say in Lean, visit the Gemba, go to the Gemba. That's where the work is done. So employee rounding is a very important piece of staffing and staffing retention. Next slide. We love this particular quote from Simon Sinek, who's a great author. Customers will never love a company until the employees love it first. So keeping our employees happy and making sure they have what they need to do a good job and be successful in their role is the first foundation to making sure that our patients are happy as well. Next slide. So a bit about engaging patients, communication, our discharge planning processes, the transitions of care, and then the overarching surveys for patient engagement. So we need to make sure that we have a safe, effective, warm provider handoff. And when I talk about warm provider handoff, that means that we have our staff members, the oncoming, offgoing staff members to actually be at the bedside and hand off, warm handoff. That's where we introduce the new staff member that's going to take over the care of the patient. We talk them up. We make sure that our patients are comfortable that a new staff member is taken over. We do our bedside reporting there with the patient and the family member. It's a really important piece of communication and the patient experience. This gives not only the patient the reassurance that the new staff member is here, what their name is, who, when they're, coming on to that shift, but it gives the patient and the family member the opportunity to ask questions, to it creates an environment where they can not only ask questions, but they can also point out concerns that they may have. And we are supposed to involve our patients and family members in their plan of care. So this is another opportunity to do just that. I love to tell stories. And one of the stories that I tell with the hospitals many times is about witnessing a handoff that was a very important, important piece of my father's care in the hospital. And I was there. They did, the nurses were doing their bedside reporting, the warm handoff process. And during that period of time, I actually heard something that was mentioned that was incorrect. And at that point, I had the opportunity to correct it. Both the offgoing and oncoming nurse thanked me for bringing that to their attention, and it was corrected immediately. So this was a great opportunity to stop something that was incorrectly documented in my father's record. So not only does this warm handoff help with our patient experience, it helps us from a safety perspective as well. Whiteboards are also a great method of communication that shows great teamwork, communication with our patients and with others. It can help you to write the goals for the day for the patient, their involvement in their plan of care. It's a great communication tool. In addition to that, we should have a venue for communication and sharing of our community resources. Years and years ago, we stole from one of our wonderful hospitals in Alabama a term that they used for a group that they started called Joint Health Partners. They involved people from the nursing homes, from the local EMS, from their wellness centers and so forth in this quarterly meeting where they all came together and talked about what we're doing well, what we're not doing so well, and how to improve the communication and the transition within our community for our patients, because we all touch these patients. This gives us an opportunity to find out about resources that we didn't know we had, and be able to support each other in our efforts to care for our patients. Developing a patient family advisory council or focus groups is another way to draw on those experiences that our patients and family members have had, so that we can use that insight to drive improvement in our processes. We think we know what's going on in our hospital, or how that patient or family member, experiences our care and our care delivery, but we really don't, because being on the other side is very different. So it's a good opportunity for us to learn what that patient and family members' perspectives are, so that we can drive improvement in those areas. Next slide.
As we think about,
Sorry. Go ahead.
oh, you're good. As we think about what happens after a patient leaves our care, a patient really never stops leaving our care. We're looking at care across a continuum, and discharge planning and follow-up calls are extremely important in a patient's care continuum. When we think about a patient experience, and when, if you think about yourself and you're sick, or your family member's sick, you want the people that you love and care about to check in on you, or you want to make sure you're checking in on your family or people you care about. And not only are follow-up calls a best practice, they also are a signal to a patient in your community that you care about them, and that it's an opportunity to help keep them, that you care about your community overall. So following up with a patient within 24 to 48 hours of discharge, one, improves quality, helps reduce the risk of readmissions, but it also is a signal to say, hey, we're here for you. We understand that nobody really wants to be in the hospital if they're sick. Nobody wants to go and spend time in a hospital or be sick in general. So having that extra touch base to say, we're just checking in, how are you feeling? One, helps connect them with their other care needs in the community. And two, is just a signal that says we're here for you and we're in this together. It also is a good opportunity to make sure that you have a follow-up appointment scheduled for a patient. Typically, we'd like to see these scheduled prior to discharge so you can communicate that information with the patient. But if you're having those follow-up calls, you can take the time to do that then as well. Implementing the use of an admission and discharge folder is what we would consider essential to making sure that a patient has the information they need as they move throughout your hospital and through their care process. One key thing that I know Carla may mention, if I don't, is that make sure that there's a pen and a notepad for these patients to have with them. One for either the family member to take notes with or the patient to take notes with. It's a simple but effective way to make sure that they're informed and engaged in their care as well. And then prior to discharge, make sure that the family is also engaged on the discharge and education and instructions. This helps make sure that the entire cohesive family unit is aware of what comes next for the patient.
So transitions of care, we have heard throughout the years around transitions and how important that is. I mean, those of you who do focus on your on HCAHPS know that care transitions has been the lowest score throughout HCAHPS and been very difficult for our hospitals to improve. But transitions of care are the places where we really do have a lot of opportunity, because those are also areas where we can have errors occur. It's really important that our transitions are seamless, that we have very clear, agreed upon workflows and communication processes, that we make sure that the continuum of care, that nowhere along that continuum of care do we miss something, because that's what seems to happen along the way. And that's, again, back to having that joint health partners, having the group in your community that all touch the patients, work hand in hand together to make the transition better. We want to make sure that we have our patients' family members and their or their caregivers involved in the care planning and that transition of care, and make sure that if we have patients that happen to be going home with home health, if we can possibly have the home health representative meet with the patient or patient's family members prior to discharge. It really kind of helps them feel more comfortable about that transition of discharging home with home health. Because I can tell you in many situations, our patients go home, they think that home health should be there immediately or that next day, and maybe that's not the way that it's been set up, but our patients don't really know. So it's important that they have a really good, and the family member have a really good understanding of how everything is going to work when they do transition to the next level of care. Next slide.
Now, everybody's favorite topic is the HCAHPS survey, and we're really going to go a little bit broader than the HCAHPS. We're going to just talk about surveying patients in general for overall patient experience feedback. As we look at how are we doing, how are we improving, it's important to have surveys sent out to patients, whether that be HCAHPS or if you're not utilizing an HCAHPS, some form of just in-home patient satisfaction survey that goes home with the patient. And then communicating the importance of these surveys to patients, actively seeking their feedback, making sure that you're including a sample survey or a reminder card to look for the survey within their discharge folder is crucial, making sure that they're following up with their care and sending you the information that you need. One thing that we always recommend is creating a letter from the administrator or whoever's actively in charge of patient experience at the hospital, but really the administrator, explaining the survey process and why the survey is important and why the patient's feedback is important. Understanding that all of you may have low survey response rates, given the small patient denominators, we still like to try to target a 30% response rate to really make sure we're getting a robust and unbiased perception of care. Sometimes with a low denominator, you all know that it can take one bad survey score and all of a sudden we're not going to make our goals for the year. However, every single survey that does come back is still crucial and something we should look into and respond to. If there's any opportunity for improvement in surveys, follow up with the patient and talk with them in person. Work with them and see what could we have done to improve. Sometimes it's not only the patients that really enjoy the care that you provide, but the patients that have really good feedback should be considered for joining the Patient Family Advisory Council. Sometimes those patients who are a little more critical are going to have the best insight to improve care long-term. And then as we look at the HCAHPS survey process, make sure that your team members are educated about how patients perceive quality and the survey responses that you're getting. And then work with those team members directly on what can improve patient experience and patient expectation. Sometimes oftentimes the frontline team members know best. They're working with the patients and doing their care right there with them every day, day in and day out. They're going to have easy recommendations to implement on things to say, we know that the whiteboard, we need to put a picture of dentures to say, yeah, the patient's leaving with their dentures. So something simple as that, or we found their glasses. Once again, posting the quality scores and patient experience scores and also patient feedback is essential to really letting everybody know where they're at and reaching a shared level of understanding. It's that common saying of you manage what you measure. And if you're not measuring your patient engagement, you're not going to be able to manage it effectively. And then also make sure you realize the importance of marketing patient testimonials to the community. A lot of times patients are more apt to come and get services based on what they hear about you either in the newspaper or radio or local news channels. So marketing strong patient having good patient testimonials is essential. One other key function on the patient testimonials is understand the diversity, equity, and inclusion demographics of your community. And make sure that you're pulling from a wide variety of patients, not just patients that look like one segment of your population. Make sure you're pulling from a diverse background of patients, so a variety of patients can make sure that they trust and can appreciate your healthcare services. And that moves us into the operational and more financial section of the presentation, and I'll give it back to Carla.
So we'll talk a little bit about inpatients. We want to make sure that we have systems in place where when we are transferring our patients to another hospital for services, higher level of care, that when they're that we want them to be transferred back. We want them to be able to come back to our hospital, possibly to for their post-acute care, for their swing bed care. We want to make sure that, we don't lose our patients. So when they're transferred, we keep up with them. We send them with a brochure about our post-acute care services so that they do know what we have available in our organization. We also want to define what we call the care spectrum. And this is where we understand and have defined the patients that are able to receive care at our facility. And this is done as a multidisciplinary team that includes our floor, our medical staff, nursing, pharmacy, anyone in our equipment area, in our therapy area, where we're all there together determining what type of patients are the appropriate patients for our facility that we can care for safely, because we don't want to transfer patients out that we can care for. Once you transfer patients, there is that risk of losing them as a patient in your organization or using services in our organizations in the future. So we need to really define a care spectrum for our organization and make sure that everyone understands what that is, and that everyone is on the same page. That decreases what we call the variability in that decision making when it comes to whether this patient can be admitted or they need to be transferred. Many times we hear that, well, Dr. So-and-so will admit that type of patient, but Dr. such and such won't. We can't have that. We need to have some type of consistent, clear picture of what type of patients can be cared for at our organization. We also need to implement intentional hourly rounding. It's very important from a patient safety standpoint. Plus, it also encourages your patients to ask for what they need when we round. It decreases call bell usage. It also increases that HCAHPS question about responsiveness of care. If we are rounding intentionally, hourly, then our patients see that we are responsive to their care, along with our bedside handoff model, which I also had mentioned earlier. It's really important too, if at all possible, to integrate our pharmacist into our patient discharge medication teaching. It's really amazing what how patients are pleased with having the pharmacist at the bedside, teaching them especially about their new medications. That really makes a big difference in the perception of our med teaching for our patients. And then when a shared level of understanding is reached between our community and our healthcare providers, expectations can be managed, and that overall experience becomes the focus rather than trying to operate the system.
And I'll just jump in here to finalize kind of what we're talking about here with defining the care spectrum and why it's so important to a patient's overall experience. There was a health system we were working with, a health hospital in Iowa that we were working with, and their CMO gave a really great story about, a heartfelt story about a family that had brought their 12-year-old in for emergency care, and ultimately found out that the services that the website had said that they could provide, they were unable to provide, and they ended up ultimately having their child pass away. And one of the quotes that he kind of left us with in that presentation is the worst time for a patient or a family to find out what services you offer is when they need it the most. So making sure that you really have it marketed well to your community about what you do and don't offer allows them to make key care decisions in a timely manner, and also let your medical staff and your care team know what we do and don't offer to transfer and make quicker decisions for key pieces of care.
Really important. Thanks, Cameron. Emergency services, and we always like to say that the emergency department is the front door to our hospital and the window to our community, and that's very true. The type of perception that the emergency department has, that our patients have about our emergency department, many times does have a part to play in their overall perception of our organization. So we want to make sure that we develop any types of strategies that we can to manage the demand for non-emergent care. Many times in our rural communities, we see our emergency departments being used as basic primary care. But if there happens to be a primary care office that is located on the campus or an urgent care clinic, it may be that if we improve some of our signage, that the patients will know that they can receive basic primary care at the urgent care or primary care offices. It's really our responsibility to educate the public around the appropriate use of the emergency department to help reduce those non-emergent visits, making sure that if we have patients that have frequent visits to the emergency department for basic primary care, that we talk with them about the use of the emergency services for primary care. And if they don't have primary care providers, enrolling them with a primary care provider so that they do have someone that they can go to that is in a more appropriate level of care. Developing that ED hospitalist model, coverage, capability with the ED provider and advanced practice provider to improve care and admissions can help to reduce those transfers so that we do have this cohesiveness between our emergency department and the floor, so that we can have, possibly have a hospitalist APP model and keep more patients on our floor instead of transferring those. Working with our medical staffs to make sure that we have gone through the appropriateness of transfer and leveraging again that ED hospitalist coverage model. Reviewing all of our patient transfers for missed opportunities. I would hope that everyone is reviewing transfers, every transfer on a daily basis for those potentially avoidable transfers. Looking at potential lean processes to reduce throughput time in the emergency department. There are so many different places within our emergency department, what we call value stream, that is from entry to either discharge, transfer, or admission, where we have bottlenecks. So it's really important that we look at, to improve our timeliness measures, that we look at that entire value stream and where those bottlenecks are and what we can do to improve those specific areas to improve that overall length of stay and overall throughput. We want to track and monitor all of our key performance indicators that in our emergency department, including, of course, but not limited to all of our ED admissions, acute observation status, and what percentage of those are a part of our ED visits. We like to target around 8 to 10%, and much of that depends on what services that you do have in your organization, targeting those transfer rates to below 5% of all of our ED visits, and then tracking all of our ED KPIs at the individual provider level. It's important that we know if we have specific providers that have less timely throughput in our emergency department. And why is that? I mean, I don't believe that I've been in an emergency department that didn't have that one provider that does that $1 million workup. It's like we call it. But we do need to understand if we have specific providers whose practices are causing our timeliness measures to be problematic. The throughput measures, door to doc, door to discharge, door to admission, transfer, all of our left without being seen, and those that are leaving against medical advice. Those are just a few of throughput measures that we should be tracking in our emergency departments.
Other department. It's really a great opportunity to look at the services that you offer and what the community needs. So reviewing one thing that you can do is review your community health needs assessment and see where are there opportunities to grow your business and grow what you offer to the community, and conduct outreach to providers to build awareness of services. That'll help bring customers and patients into your facility and foster a sense of community between you and your other providers in the area, and make sure you're promoting those services as well. Keep making sure that your equipment and technology is updated to as much as reasonably possible to promote patient experience. Good equipment, good beds, all of that makes the process that much easier for our patients to move through our system. And also, patients are looking at the small things, and the small things are the big things. Dust in the corner, dust on equipment, old equipment is going to be picked up by patients, and they're going to look at that and remember that and make note of it. And then also making sure that you're evaluating, like I said earlier, the community needs as part of a return on investment. So look at what your community health needs assessment is saying and use that to analyze opportunities moving forward. And then making sure that your staffing levels are placed in an efficient way so you can focus on volume growth overall. This doesn't just apply to clinical departments. One area that really drives patient experience as well is looking at areas such as the cafeteria or dietary nutrition services. They have a lot of forward-facing people who are working with your patients every day. So look at all the touch points that your patients are going to encounter throughout a day, and work with those department leaders to really ask, how can we enhance the overall experience of our patients? And one other thing that we talk about a lot is IT. And we like to say that IT is an asset to be leveraged rather than an expense to be managed. And when you look at IT across the care continuum, it is really embedded in everything that we do. And having a functional EMR and IT strategic plan that is guiding your IT resources and plans moving forward really helps create a high quality culture of patient safety. And patient safety and patient experience really go hand in hand. So making sure that your EMR and your IT services are up to the level of quality that they need to be to, and barcode scanning, and making sure that the patients can accurately read everything if they need to get into their chart. All of that impacts the patient experience overall and long into the future as well. And making sure that you have integrated systems as well. It's never fun to try to have to hop between 3 or 4 different systems to try to figure out what you need. And then I'll turn it over to Carla here to talk a little bit about patient portals and why those are so important as we move forward as well.
Yeah, it's really important that we go ahead while we have the opportunity, while our patients are in our organizations, that we make sure that our patients have signed up for their patient portal and that they understand how to use it. That's a great opportunity. They're kind of captured in our organization, and it's a great opportunity for us to teach them about the portal. They may not have a computer at home, but they may have a smartphone. So it would help, to educate them on the portal, have them sign up and be able to access it on their smartphone. Or if it's someone like an older person, just like my mom does not access her portal. She doesn't even have a computer. She's 90 years old, but I have access. I have been given permission and have access to her portal. So I can help with, keeping up with her appointments and looking at information that's necessary that is available on her portal that we may need to have. There are different areas within your whole value stream where you may want to begin to educate and bring up the portal. That could be at registration, or if you have a patient that has been admitted during that process, making sure that they understand the portal and how to get into the portal and are signed up. I don't know about you guys, but the last after visit summaries I have seen that have many of them that I've seen have in very, very small font, very small print about your access number to get into your portal. A lot of patients just skip right past that because they don't even understand what that means. So it's important that we take the opportunity when they're in our organization to try to teach them about the portal and have them signed up and are able to use the portal as they leave our organization.
And really wrapping us up here on the overall financial and operational best practices is this focus on what we call management accounting and making sure that your leaders, and this is really for all the administrators on the call and CFOs, making sure that your department leaders and anybody who's responsible for a department is involved in the overall operations and budget process to create ownership and accountability. And the reason this is so important to overall patient experience is if you go out and tell your inpatient or emergency services or your rehab manager, we need to grow volumes by 5% or we need to grow revenue by 5%. How can we do that? Oftentimes those department heads will have an idea in place, and it's about empowering them to go out and really get the volume, grow the revenue in the department. And a key factor of growing revenue and growing volume is making sure you have the patients to grow volume in the first place. And when they're in charge of really owning their department and having that entrepreneurial mindset, patient experience is going to be first and foremost in a lot of their efforts and what they do. So making sure that you're empowering them to go out and really be the figurehead of their own, be the CEO of their own department is going to create leaps and bounds of patient experience milestones for your organization. One thing that most of you, and I'm going to pick on Washington County here because I know I was on this call with them, is if you had a magic wand and you could fix anything or fix one thing, what would that thing be? Make sure you're asking your team members that question or asking your department heads that question. A lot of times people have a quick answer and it's not just staffing. It's, well, I would fix this immediately, or I would do this. Have those conversations, see what those magic wand moments are for your patients as well. And, if you could fix one thing about our facilities, what would it be? Take that feedback and implement it in your quality reviews and implement it into your board meetings, your quality infrastructure. All those conversations about how to improve are going to create long-term gains for your organization. And then finally, as we really focus a lot on the overall operations, as we are still not fully recovered from the COVID-19 pandemic and a staffing shortage, it's hard not to let burnout creep in and let the day-to-day monotony of the overall workload kind of pound us down. And we thought this quote was important. Be curious, not judgmental. Everybody's coming to you and trusting you with their care. It's an opportunity to create a conversation with those patients, and be curious, not judgmental, just not only with your patients, but also with your staff. Ask people what they're going through, how are their days. Overall, that improved culture is going to impact your patients as well. And Carla, I'll turn it back to you.
Thank you, Cameron. So at this point, we have time for some questions, discussion, any comments that you all would care to make. If you want to ask a question in the chat function, that's great too. We would love to hear from you. Anything that resonated with you or that you have been wanting to try or have had a barrier to or have tried and have some insights for us, that would be great as well.
Okay.
Denise?
Well, yeah, it doesn't sound like we have anything. So I'll just say thank you to both you, Carla and Cameron. Excellent presentation. Like always, we are appreciative of your expertise. Now, as we did in the beginning of the presentation, we're just going to do a quick short poll. Caleb's pulled it up for you. The polling questions are rated on the same confidence scale used earlier, from confident to unconfident. And this just helps us to measure knowledge gained on today's webinar. So we'll give you just a few moments to answer those few short questions, and then we'll be able to close it out for today. And remember, and I'll just do a quick reminder that next week we have the second part of this quality series, and it is the Just Culture. I'm telling you, that one is a don't miss. All right, so now it looks like on our post polling, we have moved all of the somewhat confidence and most of the other all the way into the confidence at 90%. So that is excellent movement. I love to see that. Thank you all so much for participating in the polls. And this concludes today's presentation. We hope that you found it informative and that it provided some useful new perspectives, ideas, and best practices to begin looking at. And again, thank you for attending the webinar and hope you have a great day.
Thank you so much.